The court will also seek to build up research capacity, because one of the challenges has been attracting more researchers into the field. But the expert group itself can only achieve so much. And if I can be perhaps a little blunt, there has been a history of fractiousness and fragmentation between different groups with an interest in this area. It's easy often to agree on what we don't like, but it's harder sometimes to agree on what the course of action and what the common ground actually is from which we can build and start to change things. So I can totally understand the heightened emotions that often are articulated by our constituents who suffer from this condition. I really can. I've had people in my own surgery and I speak to them about it. But the fact is, we simply won't achieve anything if organisations don't work together and engage with one another and find that common ground and build the alliances. Now, all patients groups need to look outwards and to be positive about how they can work with the NHS, with the department, with medical researchers and with each other to influence change. And frankly, one of the big challenges is to get more researchers interested in this area of work. And I think we're in danger, sometimes, of shooting ourselves in the foot by failing to have a united front in this area. Now, everyone with a stake in this area has an interest in ensuring a constructive and supportive environment exists for research. I think that's key. And I think divisions and discord won't accelerate the pace of change. And that's why I hope the all-party parliamentary group, as it's reconstituted, can play its part in providing us that challenge and drive us forward. Now, my honourable friend mentioned XMRV retrovirus, and all I can say is really underline the points that he himself has made. The area is one where research is not conclusive. Further research needs to be done, and further research is being pursued to establish whether or not there is a real link. But certainly there is no robust evidence to suggest there is at this time. Now, research can provide hope for the future, but I know we need to do more in the present to improve the care of people with the condition. And the fact is, the NHS doesn't always get it right for people with long-term conditions in general, let alone with ME, CFS. And the problems that many face are consistent with other conditions as well. The issues of care being fragmented rather than integrated, of people struggling to be referred to specialists in a timely and appropriate way, and perhaps most important of all, the sense of health professionals seeing conditions rather than the person actually in front of them. And in a way, this debate is about how we, whilst it's about how we describe CFS ME, it taps into some basic ideas that all too often the label does wind up mattering more than the person. And because they decide how we're treated and what the service is that you're referred to, and frankly they shouldn't. That shouldn't be the most important determinant. And we want to change this. We want the patient and the doctor to work in partnership in the consulting room, meeting, if you like, as two experts, one on the person and one on the appropriate ways to support and treat them. Now, the greater use of personalisation, Mr. Hancock, and care planning really can play, I think, a part in all of this. And it has to be, and it is, in this government's intentions, an explicit part of our plans for the NHS. But it goes deeper than this. This is really about patients being given the power of self-determination, of that idea of no decision about me without me being a governing principle of the NHS, being asked to set their own personal goals and work together with professionals to achieve them. Now, everyone's different, and we need to make sure that the care they receive reflects that. Now, I want to say something about commissioning. Although the Honourable Member didn't mention it specifically, I think it's important that we touch on that. Because to achieve these changes, to get the right services and the right specialists, we have to make sure that we have support available. And I know from my own constituency that there's excellent work that's been done on specialist CFS ME clinics to integrate care for patients. But there is a patchiness around the country, compromising the quality of the treatment and reducing the options available to people. And that's why we need to improve commissioning. And I think GP consortia can help us involve patients much more in how local services are shaped. So let me stress, the future of the NHS is local, not national. It's about local NHS and local GP consortia working with local patients groups and making decisions based on a clear understanding of their needs and local needs. So to commission effectively, GPs must understand the needs of patients with long-term conditions. And this is an area where I hope the Neurological Alliance can play an important part. The Neurological Alliance nationally and regionally has the networks of support that can make a huge difference in terms of levering change in the commissioning of neurological services. And I would urge those groups with an interest in ME, with an interest in CFS ME, to actually engage with the Neurological Alliance and use it and work through it and form their connections with it as a way of shaping and changing services going forward. So in conclusion, Mr. Hancock, I think there are some real opportunities and a real chance to address some of the frustrations and misery that people with this condition experience. And the message from me and from the Department of Health is that there is an open invitation for representatives and representative groups to get involved in shaping the future of the NHS. We want the Neurological Alliance to be a key source of advice and support for GP consortia and health and wellbeing boards at the local level. And I'm sure the new NHS Commissioning Board will also be keen to build links with the Alliance in forming national policy too. So the urgency is there, and this additional commitment to make sure that we drive this whole area of long-term conditions to the top of the agenda is part of this government's ambition. I thank my honourable friend for raising these matters today, and we will continue to work together to make sure we improve the lot of his constituents and constituents of all members in this House.